And it may be we should return in public economics to a rather more lawyerly way of arguing. So in my child benefit example, the gender equity argument adds to the case for protecting child benefit, not in the sense of modifying the social welfare function, but of bringing another important consideration to the table. It's the accumulation of arguments that is persuasive. Now, so far, I've given the lecture in front of Amartya Sen without mentioning Adam Smith, which seems unforgivable. Not least because Smith's four maxims with regard to taxation, I know Sen and Smith are now virtually interchangeable, but it's, these maxims are repeated in most public finance textbooks. Indeed, the Murley's report on taxation, to which I referred just now, begins its discussion of a good tax system with reference to Adam Smith and his four maxims for taxation. Yet, as I in fact said at the bicentenary of the Wealth of Nations conference in Glasgow, Smith would probably have been surprised to learn that his formulation of tax recommendations is still being repeated today. He describes them as simply having evident justice and utility, and they were not really very new. As it was put by one historian of UK taxation, it would be a serious misconception to suppose that the publication of the Wealth of Nations brought to the world a new revelation of the principles of taxation. What's more, the Smithian canons, are not even obviously right. According to the Murley's Committee, the maxims command near universal support. But I take the presence of so many people in the hall this evening interested in capabilities as some evidence, at least, that not everyone is persuaded of the first maxim, which says you should be taxed basically according to your income. Income is certainly not the only criterion which we want to take into account. And this brings me obviously to the third set of concerns, which is what happens if we shift our evaluative basis, and in particular, given the location, to look at the use of capabilities as a basis for evaluating, not using willingness to pay my equation of a left and right-hand side, but at the left-hand side having the capability enhancing features of public spending. And that seems a very natural thing to do. In the recent survey article by Kaushik and his co-author about functionings and capabilities, they say, in trying to empirically compare the quality of life achieved by different societies using the capabilities approach, we may need to focus on a few salient functionings. Do people in society have the option of a long and healthy life? Are people able to live lives free of political oppression? Are people able to read and write? In each of those examples I just read out, of course, a key role is played by public spending. Conversely, when approaching it from the other direction, when making the case for public spending, it's natural to think in terms of capabilities. Ironically, this is something I only learned preparing for this lecture, one of the areas where the language of capabilities has been most developed is that of defense spending. When George Robertson started his term as Secretary General of NATO, he articulated his three priorities as being capabilities, capabilities, capabilities. Now, I'm not suggesting that the association should sign up NATO as an institutional member, but it clearly is essentially, from a military point of view, exactly what they're trying to provide. So I think it is a very natural framework, and I think that in discussing austerity programs, clearly the question one has to ask is in what way are different measures that are being proposed affecting the opportunities facing different groups in society. What I want to do here, since time is short, is just to take up one of the implications of this and take up a point which perhaps is not, at least I didn't find it, very extensively discussed in the idea of justice. This is the criticism which has been made of austerity programs, that they raise issues of intergenerational justice. I think it's fairly obvious, looking at the cuts that are being made by different countries, certainly in the case of the United Kingdom, is that they fall more heavily on the young than on the elderly. I should say I wrote this before the riots in London and other cities in England. But there have been major reductions in spending on youth programs, the abolition of the Educational Maintenance Allowance, which financed or used to finance young people to stay on at school, and as I'm sure many people in the audience are well aware, there have been large increases in university fees. At the same time, there have been cuts, but much smaller cuts, in care for the elderly, and as yet, at least I haven't had my bus pass removed yet, no reduction in the program of free bus travel for those over 60. And if you look at the slide 13, you'll see that these differences in programs show up in terms of the relative benefits from certain programs that go to retired as against non-retired households. The retired receive somewhat less benefit from public spending, or at least the allocated public spending, than the non-retired, but they receive much more of health and much less of education. They receive much more of bus subsidies and much less of rail, and so on. Now, I want to also use this chart for another reason, which is just to describe how these calculations are done, because it seems to me they raise crucial issues for the capability approach to evaluating public spending. Two different methods are in fact used in these calculations. In the case of education, the benefit is attributed to those households who have children currently at school or in education. Current use of the public services is the criterion. In contrast, the benefits from health spending are not allocated according to actual use, but according to the expected use given your age and your gender. So like defense, capabilities in this case are attributed on an ex-ante basis. Ex-ante, people's opportunities are expanded by the knowledge that if they need treatment, the doctor or the hospital bed are there. And a person may go throughout life never being ill, but still derive considerable benefit and enjoy greater freedom in planning their life from the knowledge that the health service exists. Now, it may be said that in steady state, the ex-ante and the ex-post calculations average out, at least across cohorts. One just happened to be done earlier, the calculations made earlier, but over time it will average actuarially, at least over time. But I think this misses the point that different cohorts have had and are going to have very different experiences. My parents lived through 2 world wars and the Great Depression. My working lifetime, in contrast, has been affected by neither. My children, it's not yet entirely clear, but certainly those who are entering the labour force today are almost certainly going to find their job prospects and their life prospects, I suspect, considerably poorer than those of my generation. I believe, therefore, that when evaluating the benefits from public spending, in terms of the enhancement of capabilities, we need to consider, and indeed reconsider, the inter-cohort distribution. And whatever weight we placed in the past on the benefits of different generations, the fact, I think, is that we have to take a less optimistic view about the future, means that we should shift the weight in favor of younger cohorts. And 2 immediate and quite obvious implications are then that we need to prioritize services for young people, from early years interventions to youth programs, and that public investment that I stressed at the beginning of this talk should be safeguarded. Yet that is the reverse of what's happening. As I said at the beginning, public investment is scheduled to fall by 2% of GDP. A big fall, making it not much more than 1% overall of GDP. A third implication is that there should be higher taxes on better off members of the older generations. For example, it seems to me unjustified that people like me, sorry to be personal, but people like me who continue working after the age of 65 I discovered rather to my surprise when I reached the age of 65, are exempt from paying social security taxes. I can understand no reason for that whatsoever, and in this view I take a quite different view from that of the Merley's review, which has in fact proposed cutting the taxes on older workers. So I think if one thinks about the implications in terms of capabilities, then this, I think, highlights the need to think about intergenerational equity in a world where the experiences of different cohorts are clearly going to be very different as in the future. Now, turning to the last of the four objections in the idea of justice, I have so far been parochial, referring to one country, whereas a theme running through the idea of justice is that of global justice and the need to avoid parochialism in the evaluation of policy. In particular, Amartya robustly rejects the arguments of Thomas Nagel in his article, The Problem of Global Justice, that there can be no such thing as global justice. Those of you who read the book will know that there are certain bits of code in the book that Nagel's article is described by Amartya as hugely engaging. Now, engaging means he disagrees with it, and hugely means he really disagrees with it. And I agree with him. Because Nagel says that the idea of global justice without a world government is a chimera, since we lack the institutions to do anything about it. But I think I would question that even in the case of seeking an optimum, but certainly in the case of rectification, of seeking progressive improvements, there's no doubt that that can be done without presuming the existence of a world government. But at the same time, it does raise a challenge to public economics. The welfare criterion employed in typical public economics evaluations is based on a national social welfare function. Cost-benefit analysis is carried out on this basis. The British government's Green Book, as you can see from slide 14, is quite explicit. It wants to take account of benefits to non-UK residents and firms, but, it says, generally proposals should not proceed if, despite a net benefit overall, i.e. globally, there is a net cost to the United Kingdom. Now, of course, it is probably unreasonable to expect a single country's government to take a globally cosmopolitan view of justice, giving equal weight to all citizens everywhere. But we need, I think, somewhere an intermediate position in thinking about these issues. Now, in doing so, in thinking about that, it seems to me it's helpful to first of all think about the way in which individuals make similar choices in terms of their own allocations. Because individuals do provide significant private contributions to tackling global, not just national needs. They make significant, not large, but significant contributions to funding development through the actions of charities.